This week, we learned Defense Secretary Lloyd Austin was hospitalized following complications of prostate cancer surgery.
His diagnosis was not immediately shared publicly, and he was going through treatment privately, something a lot of men do. Here to talk more today about this type of cancer is our 9 health expert, Dr. Payal Kohli. Why don't you give us quick an overview first, though, of what is he dealing with? What is prostate cancer for those who don't understand this disease?
So the prostate gland is a reproductive organ that only men have, and it's really involved in providing kind of secretions and fluid for the semen. It's located near their bladder, and prostate cancer is the most common cancer in men after skin cancer. 1 in 8 men will get it, but interestingly, 1 in 6 black men will get prostate cancer. And black men are actually, unfortunately, more likely to do worse with prostate cancer, have a lower survival, just like with other cancers, than Caucasian men.
And more likely not to go to the doctor, too, which is something
that is
probably
huge.
say.
And so the screening, the diagnosis, the treatment, it's at every level that we're missing it when it comes to our Black Americans and getting them plugged in. And the worst part about this is that prostate cancer has a very high survival rate. So it's a 99% 5-year survival if you catch it early. But if you catch it late and it's spread to other organs, then it becomes obviously life-limiting.
What do we know about how Austin's cancer was diagnosed?
Interestingly enough, his cancer was diagnosed on a screening visit, so general healthy. And that's where we want to catch the cancer. You want to catch it before it causes symptoms, because prostate gland in older men causes symptoms in 2 ways. One, you can just get enlargement. It causes obstruction. That's called benign prostatic hypertrophy, where it just gets big. It's supposed to be the size of a walnut, and it can become as big as a grapefruit or an orange or really big. Yeah. The other is cancer, but the cancer is usually microscopic. So by the time it starts causing symptoms, it's usually pretty advanced. So you don't want to be waiting. You want to be getting screening tests in order to pick up your prostate cancer.
And it seems to be the stigma surrounding it. I mean, we know Austin kept this secret, until it wasn't a secret any longer, and we don't want to project on him or assume why he kept that to himself, but just talk a little bit about the stigma and how important it is to erase it.
And in a way, I'm so glad that this has happened, because it allows us to have this conversation. And the problem is with prostate cancer, it's considered an old man's disease. And so people have stigma around the fact that it causes impotence and incontinence, and it only happens in old men. And we're not normalizing these conversations, particularly in communities of color, where it's considered shameful to have prostate cancer, and people want to cover it up because it makes you feel old and it makes you look old. And the truth of the matter is, we want to start screening men for prostate cancer in their 40s. So 45 to 50 is when we want to start looking for prostate cancer, even younger in African American men, or if you've had a family member, even at the age of 40. So it's certainly far from an old man's disease. And I hope we can start to have conversations like we do with breast cancer about how normal it is. And we want to make sure that people, die with prostate cancer, not from prostate cancer, because many prostate cancers are slow growing. So you don't want to miss the boat on educating people about how to look for their cancer.
Especially when you talk about the disparities. If you catch it early, you can survive this thing and live a long life.
Right. And if you catch it early enough, and depending on the type of cancer it is, the treatments may not even leave you with those complications that you fear, such as the impotence and the incontinence and all those other. And typically the way that we treat prostate cancer is either with surgery, where we take out the prostate, that's called a prostatectomy, or radiation, where they go and put tiny little seeds in there, and they use radiation to sort of shrink and kill the cancer cells. So we can treat it without even giving most patients chemotherapy, unless it's spread outside the prostate, of course. And so people can get back to their normal lives and really live alongside prostate cancer, rather than being afraid of it, afraid of getting screened for it, afraid of getting diagnosed, and even admitting that they have it.
So just catching it early. There's so many options, but the trick is being there early. Okay, Dr. Kohli, thank you.